Hello, and welcome back to another episode of Straight Up with Steph. Today, we are talking all about nanohydroxyapatite. This is such a hot topic now, especially with all the controversy around fluoride and all that. Recently, I listened to a webinar about nanohydroxyapatite, and I learned so much just on that webinar. I realized how much I didn't know. So, I wanted to make sure that I had an expert on to talk about this today. Today, I'm interviewing Dr. Jen. You may have heard of her. She's got a line of nanohydroxyapatite products. Some of them actually do include fluoride as well. But because she created her own company and her own line, she is the perfect person to educate us on this. With nanohydroxyapatite, it is becoming more and more popular, but there's certain things that we need to make sure that our products include as far as particle size and the concentration, because there's a lot of knockoffs out there that don't use the right formulations that really aren't going to benefit our patients. It's really nice now that we have options as far as remineralization. For years, it's been only fluoride. And honestly, I've seen the limitations of that. I've had some of my xerostomia patients on high fluoride toothpaste doing fluoride varnish, and they still break down. And it's almost like you don't know what else to do. But from what Dr. Jen talks about today, we do have options with nanohydroxyapatite. And she's seen the results as far as enhanced remineralization with nanohydroxyapatite. It's really important for us as clinicians to evolve as the science evolves. And yes, back when I was in hygiene school, that was a while ago, we were taught fluoride. Just hit them with fluoride all the time if they've got issues with caries or demineralization. But now we have options. And just because you're curious about nanohydroxyapatite or want to start using it doesn't necessarily mean that you're anti fluoride. We can still use both. We've got plenty of patients that would respond better to one or the other. And it's just really nice to have more tools in our toolbox. I hope you enjoy today's conversation with Dr. Jen. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. Jen. Oh my gosh, I am so excited for this conversation today. Thank you for making the time to come on the podcast.
Oh, I'm so excited to be here, Stephanie. Thank you for inviting me.
This nanohydroxyapatite and fluoride is such a hot topic right now. And I was like, oh my God, I need to find someone to come on the podcast and talk about this. And I actually listened to a webinar through Cloud Dentistry, which one of your, and I feel so bad, I cannot remember his name. He did an awesome job. And I was like, okay, that I'm going to reach out and just see if by chance they'll come on.
Absolutely. We are happy to be here. We are a small little business, so a lot of what you hear is through me and my husband. Our kids help a little bit, so it's probably one of them.
I love that it's a family business. Whenever I hear that, I hear passion, and there's a reason that you got into this. So, what is your story as far as why you decided to create this line of nano hydroxyapatite products?
I have to say, when I graduated from dental school all those years ago, I certainly never expected to use the biochemistry that, I learned in dental school to create an oral care line. That was not my intention. I am, currently practicing in St. Paul, Minnesota. But a few years ago, we have three children. A few years ago, our oldest one, right around 2020, developed something called C. diff. And the reason she developed it is basically it's an overprescription of antibiotics. And she was attending college in northern Minnesota. She had her jaw ached, and it's difficult to get dentists, much less specialists in that area. And so she ended up being on clindamycin for about 5 weeks. And that threw off her gut. Right. She got C. diff, and hers was strong enough that she needed to be admitted into the Mayo Clinic in Rochester, Minnesota. And while she was there, the physicians were pretty careful, to explain. I mean, honestly, I knew about C. diff, learned about C. diff in school, but didn't really know how impactful C. diff is. And so the physicians were really careful to explain to her and to us that she really needed to watch out for any harsher chemicals, any antimicrobials. Her gut just wasn't strong enough to take it anymore, and almost like an infant. And so she had to rebuild. And so she had to change shampoos, laundry detergents, toothpaste. And being in the dental field, I thought, hey, I can find a clean ingredient, natural toothpaste that will remineralize enamel as effectively as fluoride. She couldn't use fluoride either because of the antimicrobial properties in there. And I couldn't. We ordered everything and could not find anything that was following the science, because the science science, and there's a lot of it. The science says we need to remineralize just based on our American diet. We need to strengthen our enamel. And we can either do that with fluoride or we can do it with nanohydroxyapatite. As long as the concentrations, the particle sizes are correct, the two actually work pretty equally in protecting enamel. But all of these clean ingredient pastes, once they take fluoride out, the FDA in the United States turns a blind eye. They don't regulate it anymore. And so all of these brands are putting in kind of really low concentrations or the wrong particle size and calling it good. And it's not good. And it's not going to protect enamel. And so I couldn't really give her any of those. So I turned to my husband one day and just said, I think we need to create a nanohydroxyapatite toothpaste that will be clean ingredients. So no sodium lauryl sulfate, take out all the stuff, the bad stuff, but then also put in good stuff that's going to help heal and help remineralize enamel. And that's how we ended up here. I created it for her. Obviously, I ended up hiring a retired chemist. He was from Germany because Europe is actually really advanced. And so they use nanohydroxyapatite. And so I hired somebody there and he helped me with the formula. And once I had the formula, I brought it to a manufacturer in the US. And we can talk about that a little bit because that's kind of a funny story too. But then once I had it in the tubes, I obviously gave it to my daughter, our family. And then I started to use it with my own patients because I saw how well it worked with her, and used it with my own patients. And the parents were asking, and then dental offices were calling me. And so it's just kind of grown from there. But it really is just a family business that we never intended for it to kind of happen like that. But here we are.
And how, I guess I'm curious, how's your daughter now? Is she okay?
Our daughter, I mean, one of the things that we've learned with C. diff is honestly, they're never quite the same. And so it took about 2 years for her to get on top of it to the point that she can approximate a diet that she used to have. But I think she'll never have dairy again. She can't tolerate it, never will. She's very, very careful with what she eats and what she introduces to her body. It's a long road.
It's gonna be like a lifelong thing for her.
It will be a lifelong thing
Yeah.
for her for sure.
But manageable, it sounds like, just being very meticulous with what she chooses to ingest and what she
Yes,
surrounds herself with, right?
exactly, exactly.
Yeah. Which isn't a bad thing, but I'm just sorry she is dealing with that. It's gotta be challenging.
Yeah.
You had mentioned creating your formulation and maybe some other brands not using the appropriate concentrations or particle sizes. So, what do we as dental professionals need to look at when we are looking at a toothpaste? Because with fluoride, it's like we're looking at parts per million, basically. Is it kind of the same thing with nanohydroxyapatite?
So with over-the-counter fluoride, 1,000 parts per million is really what we have. Prescription bumps it up to about 5,000 parts per million. Nanohydroxyapatite, what you'll want is nano-sized particles. You'll want them to be a concentration of 10%, and that's solid 10% in the tube.
Okay.
And you'll want them to be rod-shaped crystals. And there are a lot of studies on PubMed about nanohydroxyapatite. I mean, thousands of them. And it's been around since the 60s. Do you mind if I talk about the history of it a little bit?
No, please do, because I learned that on that webinar. And do you know who did that webinar, by the way?
I'm going to guess it may have been Adam. We have a hygienist who helps us out once in a while.
That
And
sounds
his,
familiar,
his
but I
name
wanna
is
give him a
Adam.
shout out because he did
Yeah.
such a good job, and I was like, "Oh my god, there were so many things that I did not know." But yeah, please tell us about the history.
Yeah, he's enthusiastic. Essentially, nanohydroxyapatite was first used in toothpaste from NASA. And so NASA was sending astronauts into space, and the astronauts were coming back demineralized. And NASA knew they couldn't send them up with fluoride because you can't swallow that much fluoride, right? They don't have sinks in space. And so NASA thought, all right, the bones and the teeth are made of hydroxyapatite. Let's put hydroxyapatite in a paste. They called it space paste, and they sent it up in space. The astronauts then came back and they were not demineralized anymore. Now, what
Mm.
happened is Japan, there's a company called Sanji, grabbed onto that idea back in the 60s and essentially created a patent on it. And so they were the first group to take hydroxyapatite and nanohydroxyapatite, put it into toothpaste. And Japan recognizes nanohydroxyapatite like we recognize fluoride. They have all the studies, a lot of them anyway, are based on a product from Japan called Apogard. And they're really the pioneers of it. And they created an amazing nanohydroxyapatite toothpaste. And they're the ones, that really looked in the research and did the research and figured out we wanted 10%. We wanted rod-shaped crystals. So I give them a lot of credit for all of the science that they pioneered. But it all started with NASA, which is crazy.
That is crazy. I like to hear that story. It's cool. Anything I'm kind of a space I like learning about space, so I'm like, "Oh, space what? Tell me more." How does nanohydroxyapatite affect the tooth surface, and how is it different from fluoride?
I'll go back first with fluoride. So, fluoride is what we are most familiar with in the United States for protecting enamel. Fluoride itself doesn't actually remineralize. Fluoride needs our saliva. And within the saliva, it needs the calcium and the phosphate. And so, fluoride combines with calcium and phosphate and it creates a fluoroapatite molecule. And that's actually what protects our enamel. And so hydroxyapatite is calcium and phosphate that actually is already in a crystal form. And with or without fluoride, it's going to help protect the enamel.
Okay. So if we take a patient that has xerostomia, maybe
Yeah.
giving them really high concentrations of fluoride isn't as beneficial as using nanohydroxyapatite because they can't like convert that or they can't do the calcium and phosphate.
I think that's what's really interesting because so many of us that were trained in dental school were trained xerostomia patients, high caries patients, throw 5,000 parts per million prescription fluoride at them because 40 years ago when they created a lot of those formulas, they honestly didn't know that it wasn't the fluoride, it was the fluoroapatite. It was a combination of fluoride, calcium, and phosphate that was actually protecting the enamel. And so you can put as much fluoride as you want in an environment that doesn't have saliva. The rate limiting factor there is going to be the lack of calcium and the lack of phosphate. And so it simply doesn't work that well. And this is just biochemistry, and there's a lot of it. It's not my biochemistry. It's really things that you can easily find on PubMed. And so a more modern approach is going to recognize that xerostomia patients don't have saliva. They don't have a lot of calcium and phosphate. They don't need 5,000 parts per million fluoride. What they need is more calcium and phosphate with a little bit of fluoride. And so that's one of the products that we created. It's called our super paste. And it's actually a combination of the 10% nanohydroxyapatite, the rod shape, all the good things. But then we just added 1,000 just over the counter parts per million, just over the counter fluoride. Combine those two, and it's magical, even in the absence of saliva. So, xerostomia patients really get great relief and they get remineralization.
So this explains why back when I was practicing full time, we had a decent population of elderly patients. Many of them had xerostomia, and these poor patients, I mean, we were throwing, the prescription fluoride toothpaste at them. They were coming in very frequently for fluoride varnish applications, still getting caries, still getting demon, and it was really frustrating for both of us. But now, I mean, it makes sense from what you're saying as far as why that wasn't working.
Yeah. And I really think that's just how we were trained. Those formulas are just older, and everything in dentistry, I feel like has changed. We're using scanners instead of taking impressions, and we're doing digital x-rays. But I feel like our toothpaste formulations are still 40 years old. It's one of those things that's like, all right, guys, come on, let's kick this in and let's start following the science.
I'm finding this as one, as I'm getting older, but also as an older clinician. I've been in the field for a while. And yes, we have been trained a certain way. And our training, I mean, some people could even say brainwashing in a way, right? As far as like fluoride, that's all we need. We just need to throw that at our patients. And I think it's really important for us as clinicians to recognize like you don't have to be anti fluoride or pro fluoride or whatever, but just keep your mind open to the science that could be changing. And it's okay to change our mind and it's okay to recommend different things that are going to work better for different patients, right?
Yeah, it's funny. We have three children, and two of them are in dental school right now. And so our oldest, Claudia, that we first talked about, she's a dental student in Minnesota. We also have another dental student in Utah. And Claudia reached out to us, and she was in her pedo rotation, and she had a patient with xerostomia. Xerostomia, they don't have to be old, right? They could be on
Right.
ADHD meds or diabetes or have asthma, mouth breathers. There's a lot of different reasons why we have a dry mouth. And so she had a pedo patient that had xerostomia, high decay, and the faculty had recommended, all right, prescription fluoride for this 9-year-old child. And Claudia texted us and said, "Oh my gosh, they're telling me, to give a prescription 5,000 parts per million to this 9-year-old with high
Mm.
decay. What should I do?" And we, as parents, we said, you know what, cooperate and graduate is what you should do. But
Yeah.
hopefully, when she gets out, I think she'll have a little more knowledge. But I mean, they're still teaching it today. So if we can nudge some of that, that's really what our goal is.
Totally. I like the cooperate until you graduate thing. I'm in ergonomics and there's some things that I teach that are not what the schools teach. And I have students reaching out and I'm like, you know what, just get through school. And then when you're out of school, you can do whatever the hell you want to. Like it's
Exactly.
fine. Yeah. Something else that fluoride is often prescribed for is sensitivity. Can nanohydroxyapatite help with that too?
You know what? I think nanohydroxyapatite is perfect for
Mm.
sensitivity. We have enamel pores, we have dentin tubules, and that's where the sensitivity lies, right? If we eat something cold, it just shoots right through to the nerve. And sensitivity toothpastes are around and have been around for a long time, but they do have a painkiller in them. That's one of their active ingredients. And nanohydroxyapatite, if you use that for sensitivity, it doesn't need a painkiller. It just really
Mm.
plugs the enamel pores and the dentin tubules. And we offer a lunch and learn, and we actually show a lot of visuals on that. And you can go to our website and see that as well. Nanohydroxyapatite, just as long as it's the right crystal size, it just coats right over and it just protects the enamel and it goes into the little fissures and it goes into the pores. And it really helps sensitivity within just a few weeks of using. I will tell you, my dad, long time, decades, long time of a sensitive toothpaste user, and I was telling him about the science when I actually formulated the paste, and telling him, no, this makes sense. And I showed him, little graphs, and I showed him, what enamel looks like under a microscope and how the nanohydroxyapatite can get in there, and he's like, oh, that all makes sense, but I'm not changing my paste. And so I finally did get him to try, and I said, if you can just try it for a few weeks, just try it for a few weeks. And now he's a total believer because the sensitivity protection is much better than what he was getting before, because it just covers all of those enamel pores and all of those exposed dentin tubules. It's really helped him out.
So you don't need the ingredient of potassium nitrate in okay, well that's nice.
No, I mean, who wants that, right? Is it
Well,
like
the less the better.
fertilizer? You know,
I know it's pretty scary what we're learning about everything. Like I wanted to mention just microplastics. That's a whole nother topic for a whole nother podcast. But you had mentioned that you have a plastic free floss. Can you just tell us about that real quick?
we do. I mean, I have to say I'm kind of the same way, Stephanie. I've got a thing with microplastics, and I've really
You
taught
can't
our
get away
family.
from it. That's what scares me the most.
Well, I mean, we're coated with it, right? And it
Yeah.
doesn't leave. But if we can minimize it, and so I wanted to create a floss as well that would be a healthier floss. And I went to, really, it's kind of like the world's floss manufacturer. There's not that many. And I said, okay, I don't want plastic in my floss. And I thought, okay, I'll do bamboo. And they said, oh no, bamboo is not plastic free. It has a line, basically a support system of plastic in it. And I'm like, okay, well,
Mm.
not bamboo. And then I said, all right, how about coconut husk? I'll do coconut husk. And they said, oh no, 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 no. There's a lot of plastic in that too. And I'm like, okay,
Oh
so what
God.
is plastic free? And they said, well, you're going to have to do silk. And so that's what we have, is we have a silk floss, and we actually soak it in nanohydroxyapatite. Nanohydroxyapatite is really good at grabbing the gunk on our teeth. And so when you put it in between your contacts, it gets that stuff out of there, the microscopic stuff especially. I will say, I'm going to warn you, plastic floss is stronger, right? So you can go in between some rotten contacts, and of course you're shredding the floss and you're swallowing all of those microplastics, but it's stronger. If you go through a bad contact with silk floss, it will break the floss. But when people say to me, oh, I'm breaking the floss, it's like, well, it's not the floss. I think it's actually
Right.
your contact. Go talk to your dentist.
Yeah.
Um, but yeah, so we have a silk floss, no plastic.
You can tell I'm a dental nerd when I got goosebumps when you said that there's no plastic and it's coated in
Yeah,
nanohydroxyapatite.
yeah.
That's awesome, and you have that available now?
We do, yeah.
Awesome. So back to nanohydroxyapatite and fluoride. We're just hearing a lot about fluoride right now, and people are very concerned about the brain effects. What is the relationship with nanohydroxyapatite in the brain? Like, is there any concerns there?
If you start to talk about nanohydroxyapatite, you will get patients that'll come in and say, "Oh, the blood-brain barrier," and because I think that that is on TikTok and Instagram, and so remember nobody's overseeing some of the brands, and so some of the brands that don't use 10% don't use nanohydroxyapatite; they use hydroxyapatite instead. They're fear mongering a little bit. And so they're putting stuff out there that's scaring people. I think the thing to know with nanohydroxyapatite, number one, is that our body makes it. It's who we are. It's in our bones, it's in our teeth, it's in our saliva. It is part of us. And so we already have it in us. Now, as far as crossing the blood brain barrier and is it safe, the best source for this is the European Union. The European Commission in 2023 released an 8-year long study, and they really dove into whether or not nanohydroxyapatite is safe for use in toothpaste. And in my opinion, Europe is really stringent, harder than the FDA is, and they really protect their people and they're careful with their products. And so if the European Commission is okay with it, I love that. Frankly, our pace follow their science. But if you read through it, you can just Google it, European Commission Safety of Nanohydroxyapatite in Toothpaste. And you can read through it. I think it's easy read. You don't need to be a scientist to understand what they're saying, but they really do promote 10% rod-shaped nanohydroxyapatite crystals.
So, what are some maybe red flags when someone's looking at a brand? You already said hydroxyapatite only. What are some other ones that people might see?
Let me go back to when I had my formula, because I think this will kind
Okay.
of explain it. When I had my recipe, my formula, and I went to companies in the US that mix up toothpaste and put it in tubes, I showed them the formula and said, "Oh, can you help me?" And every single one of them said, "Why are you putting in 10%?" Every single one.
Mm.
And I said, "Well, that's what's on PubMed. That's the science. We want to put in
Yeah.
10%." And they said, "No, all of the companies, all the brands out there, nanohydroxy brands in the US, they just put in 2 or 3%, some 1%, and they call it good." And the reason they do that is the expense. Nanohydroxyapatite is expensive. And you think about fluoride, you're putting 1,000 parts per million. It ends up being like 0.2% in the tube or something like that. Nanohydroxyapatite needs to be 10% in that tube to be as effective as fluoride in protecting your enamel. And so I said back to all of them, the science says 10%. We need 10% because I wanted to protect our enamel. And they said, "You know what? Nobody reads the science." And it's like,
You're
"No,
like,
but
I,
we
I
do.
do.
We do. We read the science and we want to make sure that our patients are well protected."
Okay. And that's when it's most effective. Okay. So I mean, I don't even know if there's an Amazon version of nanohydroxyapatite, but probably not going to be 10%,
Tons.
right?
There's tons of it. There are some companies which I feel like, we've been pushing the 10% a lot. And so there are some companies that are responding. And there is a way to take like a little bit, like 2 or 3%, and put it in a solution and shake it up and say, "Oh, this has got 15% nanohydroxyapatite." But by the time it all condenses down and actually gets in the tube, it's back to 2 or 3%. But it's misleading because I think consumers say, "Oh, this one has 15%, but it doesn't." And so the
Mm.
best you can recommend to your patients that come in and say, "Hey, I found this on Instagram or I found this on Amazon," is to say, "All right, let's look in and see what is their concentration. Is it a premium nanohydroxyapatite? Is it rod shaped?" Nanohydroxyapatite itself has a really pretty decent range. It can be anywhere from, I might be saying this wrong, but it's around 12 microns to 120. And our pores and our dentin tubules, our enamel pores and dentin tubules are in the neighborhood of 55. So you want to hover around that or lower. And so some brands might be putting in something that's much larger. And hydroxyapatite itself is about 1,000 times too large to get into the enamel pores and the dentin tubules. So it offers a little bit of help, but not what nano can do.
Okay. So hence nano. So if someone's not using nano, that particle size is going to be too big and it's not even going to like get into the tubule or Yeah.
Yeah.
Okay.
It just won't offer the same protection. And we do a lot of CE with dental teams, like lunch and learns.
Hmm.
And recently, I would say in the last couple of months, we've had two different dentists that said that about a year ago, they moved their family to nanohydroxyapatite. And it was a nanohydroxyapatite paste that was actually recommended by a dental influencer or whatever. And they didn't know the science, and their kids got decay. And one of them got decay that was so bad that she actually had to sedate two of her kids to get it taken care of. And in listening to our information and our lunch and learn, she interrupted and she said, "This is why my kids got decay with nanohydroxyapatite." She was using a diluted concentration. She didn't know. And, 2% just isn't going to protect like 10% will. And unless your patients are willing to change their diet, and, good luck with that. We want it to be the same efficacy as fluoride. I mean, that's just what we're looking for.
Well, and that's where, this misinformation kind of takes hold, right? Is someone gets maybe a crappy version of
Yes.
nanohydroxyapatite toothpaste, it doesn't work, and then they just think it's a scam. So, really
Yes,
important, obviously, to make sure it's the right size, shape, and concentration.
exactly. Exactly. Look
Yeah.
at you, Stephanie.
But when we're talking about patients, because that's a challenge, especially right now with the whole fluoride. Everyone's concerned about fluoride. Do you have some tips or some verbiage for dental clinicians when maybe they're talking to their patients about fluoride, or maybe the office wants to switch to nanohydroxyapatite? Like, is there a gentle way of saying why we're doing this?
Right. I have to say, initially, when you're speaking with patients that want fluoride free, I don't know that you'll be able to talk them out of it. I hear that a lot. We're all asked dental teams, "Hey, what do you recommend if your patients don't want fluoride?" Well, we don't recommend anything at all. And it's like, oh, that's dangerous because then they are buying the stuff on Amazon or TikTok or whatever. I think it's better to give them the information and say, "Hey, we recommend fluoride for you for this reason, but there is a fluoride free alternative out there as well." And we have fluoride free options also. So honestly, I'm not anti fluoride, but I am pro remineralizing, right? And so we have fluoride free with just the 10% nanohydroxyapatite. We also have it combined with fluoride, which is really the magical mixture that can help those patients with xerostomia. But I think it's important when you're speaking with the parents and the patients to meet them where they are at. And I also think if you were a dental office that elected to pull fluoride out completely from what you recommend, I think it's kind of understandable why you might do that now, because with everything with RFK Jr. and all the controversy surrounding fluoride right now, and honestly, looking at some of the research that's done in fluoride, so much of it was done before 1975, that it would be okay to say, to your patient pool, "Hey, we're just going to promote, something that is as effective as fluoride." And I think patients would be all right with that as well.
I really like what you said that you're not anti-fluoride, because I think some people think if you like nanohydroxyapatite, that means you hate fluoride. And if you are pro fluoride, that means you're not open to anything else. And it's like, it doesn't have to be that way. We have different tools that we can use for different patients, right? Are there some patients that would benefit more from like your super paste that has the combination of the two?
I think absolutely anybody with xerostomia, if they're
Okay.
willing to use fluoride, it really does help. And then we have a mouth gel, and I don't know if you saw that, but we released it just a few months ago, and it's kind of a typical mouth gel for xerostomia patients that they use it in combination with the super paste, but it gives them something that they can just put on their tongue and kind of windshield wiper it across their teeth whenever they feel really dry. We actually put nanohydroxyapatite inside of it. And so they're getting, the xylitol, the glycerin, all of those things that kind of promote saliva, but then also some remineralizing inside of it. It's biochemistry. If they don't have the saliva, give them calcium, give them phosphate. So the fluoride has something to grab onto.
Would using those two things for someone who's got like severe xerostomia, would that mouth gel potentially make the super paste work even better?
Oh, absolutely.
Oh,
Because
it
more
definitely does,
more
okay.
calcium, more phosphate. I mean, who's going to turn that down? What I found, I gave a lot of these tubes to some friends of mine, just to, "Hey, try this on your patients, see what they think." And one of them reached out to me and said she had an elderly patient who used a different product for a mouth gel. and had a burning mouth from all the xerostomia. She would wake up in the middle of the night and be really dry and wake up from that. And so she had it on her nightstand and she, put some on her tongue and go back to sleep again. And she used our product just for 2 nights, called her dentist, called my friend, and said, okay, so I've tried this new thing now, this Dr. Jen's, for 2 nights, and I just want to give you some feedback. And what she said is that, number one, she's not waking up. So she's sleeping through the night because she doesn't have as dry a mouth. And number two, she wakes up and she feels like she's drowning in saliva. And I mean, when do
Nice.
we ever hear that? I mean, so her dentist said, "Well, I think that's a good problem," but I thought that was a really cute response.
Yeah, that's awesome. I just want to say I really appreciate just you and your products and the options that we have now, especially something to help what used to be impossible. It was impossible to treat xerostomia patients. We did what we could, but they were still breaking down. And to have something like this that could potentially turn things around for them, that's huge.
I know. And the other piece we put in there stuff is I designed this for my daughter, right, who had all the gut stuff, and we put in natural flavoring, so it's not artificial. I wanted to make sure it tasted good because so many of the clean ingredient pastes, I'm sorry, oh my gosh, they taste awful. So I wanted this to taste good, but we put in very soothing antioxidants, some black cherry, essential oils, papaya, just things that are just super soothing to the gut, but they also are really soothing to the gingiva.
Mm.
And so if you see some periodontal patients with, the bright red and gingiva, and you have them use these products, it does actually naturally go down with some of the other ingredients in the paste.
Oh my gosh, that's amazing. As far as health with fluoride, are there any systemic concerns with nanohydroxyapatite, or is it safe for everyone, like pregnant people, kids, everyone, safe to swallow?
It's interesting because nanohydroxyapatite, if you do the research on it, it really is in so many of our products. And we actually swallow a lot of it anyway. It is
Yeah.
put in some baby foods as a form of calcium and phosphate. Remember our gut, our acid in our gut is about pH of 1.2, and nanohydroxyapatite will break down definitely at 1.2 and probably even higher than that. And so it's just breaking down into the calcium and the phosphate. But they coat dental implants, they coat hip implants with nanohydroxyapatite. They actually put it on medicine capsules. So if there are some meds that it's tough on our gut, and so to make it a little easier and a little more gentle, they coat the capsule in nanohydroxyapatite. So when we swallow it, it just helps with the digestion. It helps with the medicine to get into our system.
No, I had no idea.
Isn't it interesting? I had no idea either until we kind of dove into this, but it's kind of an interesting science.
Yeah. Well, speaking of the science, I mean, a lot of my listeners are dental clinicians and we're all nerds. We love that. Are there any studies or resources that you would point someone to if they want to learn a bit more?
Absolutely. If you go to our website, you'll see a
Hmm.
lot of them. You could go on PubMed and just search nanohydroxyapatite in toothpaste and find a ton. And I really think the research is just getting higher and higher as we go. There's more of it. And so you could go in another month and see even more of it. If a dental office wants to learn more of the science, we do a very energetic, about a 35-minute presentation, and they'll learn a lot about the science behind nanohydroxyapatite.
Okay. Well, I will make sure to link pretty much everything that we've already talked about, your website, the lunch and learns. If the lunch and learns are anything like that webinar I took, like I 1,000% recommend because I learned so much and it was just entertaining the whole time. I was engaged the entire time.
Oh, I'm so glad to hear that. Thank you.
Yeah, he did a great job. This just popped into my head. Like, do you think they would ever put nanohydroxyapatite into the water versus fluoride?
I don't know that they will because it doesn't dissolve. It's sediment, and then it's really expensive.
I forgot you
10,
mentioned that. So that's
yeah,
probably not going to happen.
it would be tough. It'd be really
Yeah.
tough.
Yeah. Do you think over time that nanohydroxyapatite will replace fluoride in more mainstream dentistry?
I think it absolutely will. It already is in
Okay.
Europe. And we tend to be just a little further behind sometimes.
Yeah.
And so I think absolutely, absolutely.
I'm just excited to see even in 5 years where we're gonna be, because I don't think it's mainstream yet, but I mean, I'm hearing more and more about it every day, it seems.
It's fantastic. I love it, and anything we can do as dental professionals to just promote, "Hey, what's your concentration in that tube?" What's the is it a premium nanohydroxyapatite? Where's it from? Things like that. Rod size or rod shaped, all the things that we want to make sure that it's there and it's transparent. And I would say if they can't get the transparency, you can kind of assume what's in that tube.
And with you, I would imagine there's maybe on your website or somewhere they can probably look at every single ingredient.
Absolutely. Yes.
That's awesome. So, how can people connect with you or connect with your company? Maybe schedule a lunch and learn. What's the best place for them?
The best place is to go to our dental professional site. It's called Dr. Jen Oral Care. When they go there, they can register their clinic. And once registered, you can schedule a lunch and learn. You can order a sample box for the office to share. You can order wholesale. I think it really helps to get the tubes in the hands of the patients. Once they start using it, I think they understand the difference and they love it. Well, we also have tear off sheets for offices that don't want to hold it in their office or carry it in their office, where you can just have them in the hygiene room. You can just tear off a sheet. You can check the box of fluoride free or fluoride, and then the patients would get 20% off their first order.
Oh, awesome. Cool. And is the only place to get it through you, or can people get it through other places? Like I always think of Amazon.
We're not on Amazon. We really want to be
Okay.
just a dental brand. So dental offices carry it, but otherwise just our website.
Okay, awesome. Well, I'll make sure to link all of that down in the show notes. I'll link your social media on there as well. And any final thoughts for anyone about nanohydroxyapatite?
I'm just so grateful that your listeners are willing to learn about it because there's so much science behind it. And as long as we help our patients make the right choices that make sense for them to protect the enamel, we're all going to be better off, right?
Yeah, and I think too, I already said this, but I want to say it again, like it is okay for our minds to be open, for us to start working with new things. Science evolves, and that means we have to evolve too, even if that means maybe unlearning some things that we learned in school.
Exactly. Exactly. Thank you, Stephanie.
Yes, thank you so much, Dr. Jen. I really appreciate your time. I can only imagine how busy you are. So thank you. And thank you everyone for listening, and we will see you next time.